And I'm Tom Backley. I'm the CEO of the Beach Cities Health District. Really pleased that you're here tonight for our fifth Safe in the South Bay series. And we've been doing these for 6-7 months now. And when we first had this idea, we were working with our partners at the chambers and the business community. And this was back in August or July, and we were trying to think about how we could reopen safely. And so this idea came from our partners at the chambers, and we thought, wow, what a great idea. Let's do this for the whole community. So we've had other topics ranging from vaccines to school issues as we dealt with the surge that all of us know about, obviously, in December and January. Well, we're getting back to our roots now a little bit and talking about reopening and what does that look like and how do we reopen safely and return to work safely. So we have a great panel here tonight for you, and it's obviously exciting to be talking about this. This is something that we've all been looking forward to, and so it seems to be happening. We need to continue to be safe and do the things that got us here, but it's very exciting to be talking about reopening, and I want to turn it over to our partners tonight that are going to lead the discussion. We have Kelly Stroman with Manhattan Beach Chamber, and then we have Jessica with Hermosa Beach Chamber. So they're going to be leading the way tonight. And thanks again for being here, and we'll be seeing you soon, I think. Thanks. Kelly, I'll turn it over to you.
Thank you, Tom. I appreciate it. And it's a pleasure to be here with everybody tonight. Okay, I have the duty of sharing some of the ground rules and basics with you before we get started with our panelists. The ground rules. The Q&A feature is available for you to use. Type in your questions, your thoughts as they come up with regards to each panelist, and we'll be asking those questions at the end. The panelist screens will be on, and you can view in speaker or gallery view based on your preference. The chat is turned off for attendees, so please, again, put your question in the Q&A function. This session is being recorded and will be shared in a post-event email with resource links and contact information to reach all of our panelists. So don't worry about taking too many notes, because you'll be able to view it afterwards. Okay, how we will spend our time together tonight. Our time this evening will have 3 segments. First, our panelists will each present key aspects related to the COVID-19 vaccine and this phase of the pandemic we are now in. Second, we ask our esteemed panel the questions you submitted in advance when you registered. And we'll dedicate the remainder of the evening answering any additional questions you have live through the Q&A feature, as I mentioned before. You are welcome to submit questions at any time. And finally, we will be introducing the poll feature tonight to invite you to interact and participate around this important topic. All right, to kick it off, we want to check to see how everyone is doing tonight, what you're feeling. So if we can cue up the first poll, taking all things together, how happy would you say you are right now? With 10 being extremely happy, and obviously 1 being extremely unhappy or not feeling so good. So we'll give you just a few minutes. Please click your answer. We'll give you a few more seconds.
You might think that would be an easy question to answer, but some folks might need a minute to think about that.
And we want your honest. Again, you know, we want your honesty. So tell us how you're feeling. And we can't see your individual identity attached to your answer, so don't worry about that. Just go ahead and log it in. Okay.
Awesome.
Are we going to see the results pop up? How are we feeling?
There we go.
Okay, so it looks like the majority of you are on a scale of 1 to 10, with 10 being extremely happy. You're about an 8 tonight. That's pretty darn good. And then number 7 came in second. We have a few that are extremely happy. And the good news is we have no one who's extremely unhappy. or even close to it. So we're off to a very good start with the first poll. We're going to pop up some of those polls here and there throughout the evening. Okay, Jessica.
Thanks, Kelly. That was a great response from everybody. So with that, we're start the introductions of the panelists. And our first panelist tonight is Lisa von Eschen. Lisa joins us today from the Maloney firm in El Segundo. Ms. von Eschen counsels businesses and nonprofit organizations on employment law compliance issues, including exempt classifications, leaves of absence, payroll, discipline, grievances, terminations, and reductions in force. She's conducted successful trials in both the California federal and state courts and argued appellate victories before the California and Ninth Circuit Courts of Appeal. In 2018, Ms. von Eschen was named to the Daily Journal's list of top women lawyers and has been recognized as a super lawyer on the Southern California Super Lawyers list. She graduated from New York University School of Law and earned her Bachelor of Arts in English with honors from the College of William and Mary. Ms. von Eschen resides in the South Bay with her husband and children, where she volunteers on several boards.
Okay, next up, I'd like to introduce Dr. David Chevelle. David Chevelle is a board certified interventional cardiologist and serves as the medical director, adult cardiology and interventional lab and co-director, adult ECMO program at the MemorialCare Heart and Vascular Institute at Long Beach Medical Center. He chose medicine as a career because of early childhood memories of his father, who was a nephrologist. Dr. Chevelle developed a particular interest in cardiology because of the strong basis on physiology and similarities to basic mechanical engineering principles. Dr. Chevelle completed college at UC Irvine with a degree in mechanical engineering before attending UCLA Medical School. He then completed internal medicine residency at Harbor UCLA Medical Center in Torrance. He then worked as a hospitalist at Kaiser Permanente in Harbor City for 1 year prior to entering general cardiology fellowship at the University of Washington in Seattle, Washington. He returned to Los Angeles to complete a 1-year fellowship in interventional cardiology at Harbor UCLA Good Samaritan Hospital. He subsequently joined a large private practice cardiology group at Good Sam Hospital at the same time working at Harbor UCLA in the Division of Cardiology with a faculty appointment at the David Geffen School of Medicine at UCLA. He then spent the last 11 years at the Keck School of Medicine at USC.
Wow, what a lineup we have tonight. Next up, I'd like to introduce Dr. Aman Halai. Dr. Aman Halai is a medical epidemiologist and unit chief of the Vector-Borne and Neurological Diseases Unit at the Acute Communicable Disease Control Program at the Los Angeles County Department of Public Health. Under the COVID-19 pandemic, Dr. Halai is leading teams that conduct COVID-19 worksite outbreak investigations, COVID-19 mother-baby linked surveillance, and is currently coordinating vaccine rollout in the food and agricultural sector in LA County. Dr. Halai trained in internal medicine at University of Missouri, infectious diseases at UCLA, and public health at Harvard T.H. Chan School of Public Health.
Nice job, Jessica. We have a lot of big words here tonight.
We do.
Okay, we can handle it. Last but not least, we have the wonderful Dr. Mo Gelbart. Dr. Mo Gelbart is the Director of Behavioral Health at Torrance Memorial Medical Center and Executive Director at the Thelma McMillen Recovery Center. Dr. Gelbart is a licensed clinical psychologist, a graduate of the University of Southern California, and has been practicing since 1976. He has expertise in alcohol and substance abuse, is certified by the American Psychological Association in the treatment of substance abuse, and one of the founders of the Thelma McMillen Recovery Center. In addition to his role at the Thelma McMillen Recovery Center, he has been the director of Gelbart and Associates, a multidisciplinary mental health group in the South Bay for 40 years. The practice recently merged with community psychiatry, where Dr. Gelbart serves as Director of Practice Development. He has been a consultant to the California Medical Board Diversion Program and the California State Lawyers Assistance Program, and has wide experience in workplace violence and stress, managed care issues, chronic pain, and works with adolescents and adults in individual, couple, and group therapy. Very impressive. We're pleased to have you, Dr. Gelbart. Okay, so now we're ready for our next poll question. If we can cue that up. As of today, please answer. I have received at least one dose of the vaccine. First answer is yes, I have. I'm undecided. No, I'm waiting for my turn. No, I prefer not to get the vaccine, or I prefer not to answer this question. Again, your answers are anonymous. We will not see who answers how, but we appreciate you answering this. Take a moment. Again, as of today, I received at least one dose of the vaccine. Yes, undecided, no, not yet. No, I prefer not to get the vaccine, or I prefer not to answer the question. Okay, how are we doing on that? What do we have? Okay, wow.
Wow.
So out of all the attendees today, 76% have received at least one dose of the vaccine.
Wow, that's great.
Interesting too, no one's undecided. Okay,
Good.
I like it. All right. Okay, so first we are going to turn it over to Dr. Halai to give an overview of the state of COVID-19 and vaccines, a reflection on our progress 1 year later, and an update on the opening, current tiers, and the challenges and opportunities for the workplace. Dr. Halai, it's all yours.
All right, can you guys hear me okay? Yes?
Yes, we can.
All right, excellent. Thank you for having me here. Next slide. So today I'm going to give an update on COVID-19 trends, and then talk about some new changes that have taken place in our guidance, and then also talk about workplace implications. Next slide. So let's start off with kind of reflecting over the past year. It's truly been a historic time for us. This year in January, last year in January, when we started to hear of the first rumblings of a pneumonia-like illness from Wuhan, China, from a new coronavirus. And at that time, we didn't really understand the scope of what we were dealing with, and that it would become a global outbreak of such proportions. And in a year of unprecedented and really tremendous discovery and innovation, here we are, a little over a year later, with so much more knowledge and understanding of the virus, what it does, how it how people react to it, how we can test for it, and in terms of treatment, what works and what doesn't work. And we not only have one, but several vaccines. Our schools are beginning to reopen. Testing is widespread. Hospitalizations and deaths are reducing. And so I think we're in a really good place right now. And we have accomplished so much in the past year. Next slide. So let's start off with the numbers. For LA County, we have 10 million residents here. Out of the 10 million residents, about 6 million persons have been tested at least one point. And we've had 1.2 million cases overall. 22,806 people succumbed to the disease and lost their lives. That's a sobering number. In terms of trends, if you look at the blue graph, you'll see the percentage of tests that are positive. And you can see that that's downtrending. That's a good sign. That means the number of people out of the tests that are being conducted, the positivity rate is lower. And so less people are positive. And then if you look at the next graph, which is the number of deaths, we know that the deaths lag behind testing and diagnosis. And so that kind of timeline matches up, but that's also on the downtrend. So that's, again, a good sign. Next slide. So this is a busy graph, but I really want to focus on the green line, which shows the trend in the cases over time. And so starting from March last year, you can see that we went through a period of like ups and downs. And then there was this big surge starting end of November, going into December and January. And now the cases are going down. As the community transmission has varied, so have our recommendations. And, you know, it has been frustrating for many of us to see, okay, is indoor dining open now? Is indoor dining closed now? But this is the way we've had to adapt and really, you know, react to the situation as well as try to prevent further worsening. And so that's that you can see on the graph here. Next slide. The blue line is the trend in cases, and the yellow is the number of people that are getting vaccinated. Now, I don't think that this graph means that the vaccinations are driving down the numbers necessarily. What we know from studies is that the younger populations, they are the ones that really account for most of the transmission. And what we have focused on for the most part until at least the beginning of the month have been our older population. So if it was a vaccination effect, we would have seen a decrease in death and hospitalization, not necessarily a decrease in the case numbers. I do think that timing has been in our favor. And this is where we want to be. We want to see the cases go down and the vaccinations go up so that when we are faced with another surge, we are well prepared and the vaccinated individuals interrupt further transmission. Next slide. In terms of vaccination, you can see the numbers from across California. We've done pretty well in Los Angeles County here. Over 3.6 million doses administered. Over 1.2 million people have completed the vaccination series. I think this is all a good sign. Next slide. So you guys may have heard about the tiered system. So this is a system that California uses. It's under the Blueprint for a Safer Economy. And it allows the counties to move through various tiers based on certain metrics. The metrics are positivity rate, so the test positivity rate, the adjusted case rate, as well as a health equity index. And based on that, on March 15th, LA County moved from widespread transmission to substantial transmission. And if we continue on our current trend, we may be able to move on to moderate or orange tier in April. What does this substantial or red tier mean? Next slide. It means that we can relax our restrictions a little bit, but not a lot, because we still have substantial transmission. So what this has meant is that it has allowed changes and allowed more, so the restrictions to be lifted essentially. So for example, for restaurants, indoor dining is now allowed at maximum 25% capacity or 100 people, whichever is fewer. And then for outdoor dining, that has expanded to include up to 3 households, up to 6 people. Previously, it was only 1 household per table. For schools, schools may now fully reopen for in-person instruction. Movie theaters are now allowed for indoor operations at 25% capacity or 100 people. Gyms, fitness centers, and yoga studios can now operate at 10% capacity. Museums, zoos, and aquariums can now operate at an indoor capacity at 25%. Next slide. Breweries, wineries, and distilleries, if they do serve meals, they function as the same as restaurants. If they do not, then they can only be outdoor services. Limited service. So limited service businesses open for indoor operation at 50% capacity, offices, essential indoor operations at 50%. mental health support groups and spiritual counseling, that number has expanded from 10 to 12. So little steps, but steps in the right direction. Youth and adult recreational sports, they are now allowed under state guidance if they do adhere to the requirements, including testing. Next slide. For K-12 school, the big change that has recently come about is the distance. And so the minimum distance has moved from 6 feet down to 3 feet, as long as other measures remain in place, including masking, stable groups. And then the distance between the teacher and other staff should be at least 6 feet from the student and other staff desks. What has not changed is that all schools can open for in-person learning, but continue to offer distant learning as an option. There has to be daily symptom screening, high mask adherence, physical barriers between students to minimize contact. And if a school is allowed to reopen, then they can stay open, even if we move to a lower, more restrictive tier. Next slide. So this is the data behind the move from 6 feet distance to 3 feet distance. You know, it seems like, well, we've been doing 6 feet all around. So why for schools? Why are we moving to 3 feet? Well, there's data that supports this. So this data came out of the public schools in Massachusetts. And if you can see the yellow line, that's the case rate with the 6 foot distancing for students. And the orange line, that's for the case rate in students at 3 feet. And there's really no difference. For the blue line is the staff case rate at 3 feet. And the gray line is a staff case rate at 6 feet. Again, not very different. What is different though is the case rate between students and staff. And this is similar to what we have seen in Los Angeles County. And now that staff are going to be vaccinated, we really think that it's going to be safe in the school as long as we follow the basic control measures, masking, 3 feet distancing, stable groups or cohorting, screening. So as long as those are in place, the schools can safely reopen. Next slide. So for the workplaces, reopening has many challenges, but it also provides many opportunities. In terms of challenges, the biggest challenge through this pandemic has been, the ever-changing information, like information 1 week ago is out of date the next week. And how do we keep track of it? How does a person in the community keep track with this ever-changing information? And it's been a challenge. We try to keep our websites updated. There are trade associations and we work with unions to spread the messages, but it really comes up down to the person and they really need to take the initiative, an employer, a business, to stay up to date with our guidance documents and, our changing recommendations. And as those recommendations change, people have to be adaptable. Companies have to be adaptable. They have to be nimble and be able to modify their physical space, their setup, their administration based on those recommendations. The other challenge is going to be as we move from high transmission to low transmission, once the restrictions have been relaxed, how do we reinstate them? And that's going to be less socially acceptable as we move into COVID fatigue. We are all getting tired. It's been a year. We've talked about it to no end. We've thought about it to no end. It's affected all of our lives and we just really want to move on. And so I think that's going to be a big challenge. But in terms of opportunities, I think we have made a lot of progress. There's been an immense increase in understanding of infection control concepts and standard practices at a workplace level, at an individual level, and that can translate into prevention and control of other infectious diseases, especially when we talk about seasonal influenza. There's been an increase in telehealth and occupational health programs, and if we maintain those, that can increase healthcare access and healthcare quality. The telework capabilities, we've all had to modify the way we work. And if we do keep up with some of the flexible work schedules, it can really improve the quality of life of our workforce, can reduce road congestion, emissions, pollutions. And then, as we get more and more data, we're finding out that some industries are disproportionately impacted. And it has highlighted inequities, vulnerabilities in the workplace. And it's a time for us to reflect and try to address those working conditions and improve conditions across all our industries. Next slide. So who's currently eligible for the vaccine? We've moved through phase 1A, so healthcare workers, staff and residents at nursing facilities and long-term care facilities. We're in phase 1B, residents over 65, at or over 65, I should say, education and childcare, emergency services, food and agriculture. And more recently, people with serious health conditions, people who live or work in congregate living spaces, janitorial, custodial and maintenance services, and transportation and logistics have become eligible. If you do have questions about eligibility on our webpage, you can go to the landing page, and then if you just hover over like the subgroup, you can find more information about that particular group and who's considered eligible in that group. Next slide. So as we know, there are 3 vaccines, 2 mRNA vaccines, Pfizer, Moderna, and 1 viral vector vaccine, the Janssen or the Johnson & Johnson vaccine. The mRNA vaccines are 2 doses and the Janssen vaccine is 1 dose. Really, the take-home point from this slide is they are 100% effective at preventing hospitalization and death, all of them. There's been questions about, hey, the Janssen vaccine may have lower efficacy. The data cannot be compared across the trials because they all use different populations. They were done at different times. They defined cases, side effects, failures, all in a very different fashion, but all of them were effective and safe. And what we repeatedly say at Public Health is the best vaccine is the one that's available to you. Next slide. So what changes after someone gets vaccinated? If you've been fully vaccinated, you can gather indoors in small numbers with other fully vaccinated people without a mask. Hey, that's a change, right? You can gather indoors with unvaccinated people from one other household, as long as they are the people that those people or anyone they live with is not at a risk of severe disease. So one unvaccinated household. If you've been around someone that has COVID, you no longer need to quarantine and you don't need to get tested unless you have symptoms. Symptoms always means get tested and take precautions. Next slide. You will still need to take steps to protect yourself, such as wearing a mask, staying at least 6 feet apart from others, avoiding crowds, poorly ventilated spaces, especially in public, or when gathering with unvaccinated people from multiple households, right? Because the more people you vaccinate with that are at risk, the bigger the chance that one of them gets infected, gets severe disease. Or, you're with one unvaccinated person at increased risk of severe illness who lives with another person at increased risk. Because you really have to think about the chain of transmission. What if you give it to that one person who gives it to someone else? What is that? The whole risk is in a chain that we must consider. You should still avoid medium or large size gatherings, delay domestic or international travel, and still watch out for symptoms, especially after exposure. Symptoms always means you should get tested and stay home and away from others. And also you will need to follow any guidance that is in your workplace. Next slide. So I want to, spring break is around the corner, and I want to say that we still do have quarantine recommendations for LA County. So if you are traveling, when you return, you must quarantine for 10 days. There is a lot of, even in the US, there is areas such as New York that have surges going on at this time. There are some variants that we are concerned about. Not too much of that in California, but it is there. But, travel increases, you may think that you as a person are not at high risk, but when we think about populations moving, then the risk is really multiplied. And that's the reason, you can travel if you take safety precautions, but when you come back, you must quarantine for 10 days. And until enough people are vaccinated, everyone must continue to stay safe. Thank you.
Thank you, Dr. Halai. We appreciate that. And with that, we are going to transition into another quick poll. If we can pop that up, the question now is, the most trusted source of information about COVID-19 vaccines has been my employer, my doctor, media, community organizations such as Beach Cities Health District, the Chamber, etc. Really, Beach Cities Health District, the Chamber, I'm going to root for both of those equally here. Friends and family, other, or prefer not to answer. So let us know your trusted source of information. I promise you don't feel obligated to choose us. Please answer honestly there. Little comedic value there for you, but we're hope you feel comfortable. These are anonymous when you answer. I'll give you a few more seconds there to answer. All right. And I think we're going to get the results. Here we go. Look at that. Community organizations. Beach Cities Health District has done an amazing job at getting information out about vaccines. Hopefully you are here today attending this because you heard about this today from the Chambers and the Beach Cities Health District and other community organizations. So that's a great result there. So we appreciate that. Thank you. So next we're going to move on to Lisa von Eschen, who will share about the laws, rules, and regulations related to COVID-19 and the workplace employer COVID-19 mandates, liability of businesses for unvaccinated employees, how to safely reopen, and what to consider. The floor is yours, Lisa. Thank you.
Thanks, Jessica. This has been, I've been asked to speak about this several times in the last year, so I'm hoping that we're actually finally going to be doing some reopening. If I could get the first slide, that would be great. And then the next slide. Thank you. So I was asked about guidance or what rules would cover for California employers, and the state actually has emergency temporary standards, ETS, and after the program, they're going to share some links and resources, and one of those is a link to the Department of Industrial Relations webpage, which has a great Q&A on the ETS and really is very easy to understand for employers who are looking and needing to reopen. One of the requirements from the state level is preparing a written COVID prevention program. And it's pretty detailed. It governs, what you have to do for cleaning. You prepare it and put in there like what your plans are in order to have your business be reopened. And then that's what you would follow. And there is a model CPP on the Cal OSHA website, which is also linked on the DIR website that'll be included in the materials. Next slide, please. So a couple of pieces of legislation. One of these is starting in January. California businesses actually have one business day after they get notice of a potential workplace exposure to inform everyone who's at the site and also provide information on COVID benefits and as well as details of what they're going to do as far as disinfection and the safety plan. And the benefits actually changed. It's always changing, but changed as of just about 10 days ago. There is a new statewide COVID supplemental sick leave of 80 hours available to employees for businesses of 25 or more. So this is something you always want to double check and make sure you're giving your employees the proper information about. Next slide, please. So other obligations, if you have an outbreak, and that's defined differently under different circumstances, you need to report it to the local health department within 48 hours. For this purpose, it's defined as 3 or more confirmed cases among your employees from different households within a 2-week period. If we go to the next slide, then we'll see that outbreak is defined differently for purposes of a workers' comp exposure. You may remember at the beginning of the pandemic, Governor Newsom signed an executive order and said that we're going to just presume, we have a presumption that anyone who gets sick within 14 days of having worked probably was presumed to have caught the virus at work, and therefore it would be covered by workers' comp. That executive order expired in July, but then was re-implemented in September. At least for a non-healthcare setting, it needs to be at least 4 out of 100 employees who have worked to have this presumption. That doesn't mean that there wouldn't be others who could potentially be exposed at work if it wasn't in an outbreak setting and look to workers' comp, but it's presumed so if it's a larger number of people who have it. As far as liability goes, beyond workers' comp, what I'm telling my clients at least is, follow the rules to the best you can. And that's sort of the best defense, at least at this point, as far as making sure that we limit the exposures, but also have a good position if there is one. So to that point, next, on guidance, we have, the state ETS, and then what I direct people to all the time is the county website as well. And that's industry specific. And this will be included in the link, a link will be included in the materials as well. It goes by industry. So Appendix D, for instance, which is on the county website, deals with office-based business protocols. There are different ones for like restaurants and retail, but importantly, they're very, very detailed, and you can go through them if you're either the employer or an employee and see what it is that your business should be doing to make sure that you're safe. And these are updated very frequently. Appendix D, this is the most recent quote from this. As far as masks, they're still required to be worn in the office at all times if an employee is likely to come into contact with anyone. And the only time they're not supposed to be wearing them or allowed to not be wearing them is if they're alone in the office with their door closed or they're eating or drinking. And then indoor capacity is now for essential businesses, which have reopened, limited to 50% of maximum. That's an ad that was actually made last Friday. So I always tell people just keep checking and you'll see. I get this question a lot with respect to businesses that have reopened. What if someone says, I don't want to wear a mask? We know that's been a hot topic in the world, in the country. Can the employee work from home? Potentially, yes, if they have a job that can be performed from home. If they have a medical condition or a disability that would prevent them from wearing a mask, it might be a required accommodation. And LA County on the website, at least as far as Appendix D for office businesses, says that if they can't wear the mask for a medical reason, then you could be required to provide them with a face shield with the drape on the bottom edge. So as far as reopening, we talked about the state ETS and the county website, and businesses don't want to forget their city that they're in and whether there are any rules there. Even their building may have requirements about the elevator or parking. And a lot of the common themes are health screenings that are required for employees when they come to the office, as well as visitors, the temperature checks, a log of visitors so that contact tracing can be done. And then rules that would be followed for the masks, hand washing, environmental cleaning, and PPE to be provided. Something to think about for employers if they aren't staggering schedules of employees is workspace design. Maybe you have different entrances and exits. You might have one-way traffic, or see how people's desks are set up and how far. This can, I think, is going to become more and more important as we start having a reopening and then having mixes of vaccinated and unvaccinated employees. So what happens when you do have a COVID positive case in the office? If we go back to that CPP at the beginning, that's particularly why it's important. It'll deal with, notice to other employees, and then rules that you've set for how long are you going to have them stay out, 14 days. It's important to have that plan, not only because you have to have it written down, but also to follow it so that people are treated equally, and no one can say, you treated Joe's COVID case differently than you treated Mary's. I get asked this a lot too. Can I send my employee home if they seem sick? In a pandemic, that question is a little different, and it's easier to do. If you observe, or if someone tells you they've observed symptoms that are consistent with the virus, an employer can require someone to go home, and they can ask them to seek medical treatment. You just want to make sure that you focus your inquiry on the symptoms themselves. Fever is kind of obvious if you're doing a temperature check, but if they're coughing or having breathing difficulties or don't appear well, you want to focus on those and not what might be an underlying health condition or disability, like, hey, I know, you had cancer last year, or you're older, or mention anything of that nature. So another issue would be, what do we do as far as accommodating, especially with respect to when things are being reopened? If employees feel that they want a different schedule, or they're asking for changes to their workspace or anything like that, they may make a reasonable accommodation or a work alternate request. And they don't automatically get what they ask for, or their preferred accommodation. What they ask for is evaluated under a standard of what would the cost be, and or what might the burden be on either other employees or the business. The most important thing to do if you're an employer or an employee who's looking to go back is to set up what's called an interactive process meeting to discuss and having an open dialogue. So this is a question I get a lot. What happens now that we're reopening and my employees tell me, hey, I really like working in my pajamas, I don't want to come back to work. Is that a reasonable accommodation, and do I have to accommodate it? Well, if it's just because they like working in their pajamas, then no, that wouldn't be a reasonable accommodation. But if they want to continue to work remotely because of a medical condition or a disability, then potentially, yes, it could be something you'd need to accommodate. Could the reason that they want to continue to work at home be anxiety or stress? Would you have to accommodate that? Potentially, yes, if it were a disability or an ongoing condition. Does family care count? It could, if maybe they're in a household where they're caring for an older parent who maybe is going through chemo and they don't want to expose them unnecessarily. For school schedules, it's not the same to be required as an accommodation. There is the new COVID sick leave that would give them 80 hours to use to juggle, to manage schedules. But I also like to tell people that, hey, we've all been through a lot in the last year. So if you're juggling someone's schedule because their child's school is reopened partially, but not fully, like maybe that would be a good requirement or accommodation to make, even if it's not legally required at this point. Unvaccinated employees we'll get to at the next slide. So, sorry, we need to go right the other way. Thanks. So one point on accommodations is just that when you're talking about someone that wants to continue to work at home, then it may be hard to argue that that isn't an effective accommodation if they have been doing it well from home for the past year. So next slide, please. Thank you. On vaccines, I'm getting a lot of questions on them. Can an employer mandate it? Can we require that our employees be vaccinated? The EEOC in December said yes. There are three main reasons that an employee can say they need an accommodation and that they wouldn't be vaccinated if it's required. One is health, so a disability or medical condition. And if you're pre-screening, you want to be careful about asking questions that might reveal their PHI or personal health information. Another reason is religion. And basically, it's just a standard of having a sincerely held belief. You don't, as an employer, get to inquire into that belief if someone tells you that their religion prevents them from wanting to get the vaccine. Or employees may raise the issue of the fact that the current vaccines, and I will defer to the other panelists, are currently distributed under the Emergency Use Authorization Act by the FDA. And it's interesting, this month, the California Department of Fair Employment and Housing said it's okay for employers to mandate FDA-approved vaccines. I'm wondering if that's going to be corrected, because technically, I don't think that covers the ones that are out there. But as I said, some others might comment on that one. And then the final slide that I have here is, I think, what people are particularly interested in, which is, well, what do we do if we want to have everyone vaccinated, and how do we handle the ones who don't want to be vaccinated? If they've raised the religion or the ADA or potentially, another issue that you need to accommodate, then you would look at, can we how do we accommodate them? So do we give them a reasonable accommodation? The medical issues are evaluated under a direct threat standard. And basically the best way I could explain that would be that if you had a COVID positive employee, then bringing that person to the office, it would potentially be a direct threat under the law to the others who are working there, because they're infectious and it could be a problem. If you have an unvaccinated employee, bringing them into the office, it's a different question if them being unvaccinated would be a direct threat to others who work there, or if having them come into the office would be a direct threat to them. And I think that question might actually change as we get further along into the pandemic and the case rates drop and the vaccination rates go up. It's less and less likely, I think, that having one or two unvaccinated people who come into an office of mostly vaccinated employees would really be a problem. One thing I think is important to note is that employers should not be sharing if people aren't vaccinated. It's their own personal information. You don't want other people asking them, hey, why aren't you vaccinated, which might reveal a disability, or maybe pressuring them to get vaccinated. You could have morale issues. If someone isn't ready or able to come back because they're not vaccinated and you're looking to accommodate them, you could consider having them come back, but using additional, double masking or isolating, moving their workspace somewhere else on the floor or changing their schedule. Again, maybe continued remote work, or maybe last case, a leave of absence. That's what I have on these issues before. I'm sure there'll be questions.
Thank you so much, Lisa. You are always so helpful in navigating all the employee-related law. And again, Lisa von Eschen with the Maloney firm. So as we queue up the next poll question, if we could, I want to remind all the attendees that you have the ability to type a question or a thought into the Q&A function, not the chat function, but the Q&A function. So as we move through to our next speaker, please type in your questions, and we'll get to them at the very end. All right, so the next poll is, in reflecting on the last year of the pandemic, did you adopt a new positive, healthy behavior to cope with stress? Yes, unsure, no, or you prefer not to answer. Please log in your answer. Again, they are anonymous. And it's always helpful for us to know where you stand. Once again, in reflecting on the last year of this pandemic, did you adopt a new positive, healthy behavior to cope with stress? Yes, unsure, no, or prefer not to answer. We'll give you a few more seconds. And then if we could show the results. Yay, okay. We have, yes, a lot of healthy behaviors adopted in the last year to cope with stress. That's the good news. Okay, thank you very much. Okay, excellent information so far. Next up, we have Dr. Mo Gelbart. He will share about the effects of COVID-19 on supporting employee mental health, how managers can check in on their employees, resilience, adaptability, conflict resolution, how to ask for help and give support. He will share resources via BeSafe and other apps, employee-related benefits, third pandemic, and a bunch of information will help all of us navigate as we continue to move through the pandemic. Dr. Mo Gelbart, welcome. Thank you for joining us again this evening.
Great. Well, thank you for having me, including me in this great panel. If you put the first slide up, we can get started. There we go. And that should say really employee mental health, facts, figures, and solutions. Next slide, please. So one thing that that we've all know, and even though some people say to do the opposite, you can't separate emotionally work from home. And so we bring our work home with us emotionally, our mental thoughts and feelings, and we bring our home issues over to work. And therefore, it's essential that a workplace recognizes mental health issues and what makes people cope better in general. And it's even before COVID, but becomes even much more so during the COVID year. Next slide, please. So mental health in 2020 has been suffering tremendously. In fact, we really believe that there's going to be a long-term consequence of this in terms of people's depression and anxieties, and post-traumatic stress will maybe follow us for years to come. We have the highest rates of depression, anxiety, suicidal ideation. We have very high rates of substance abuse, as this chart shows here. Put my glasses on. Between 30 to 60% of people across the age ranges report being depressed during this year. And interestingly, it's the younger people, 18 to 24, who have higher rates of depression. Somehow the older seniors, like myself, are coping a lot better. Amongst the kind of problems people are having is people are moderately stressed. Could you put the next slide, please? 90% of people say they're stressed. 62% of people say they lose productivity. Prescriptions for anxiety are up 40%. Mental health requests for treatment are up 100%. Most people in this community that I know are totally swamped. People meaning psychiatrists, psychotherapists, the self-help groups, the large groups. It's very hard to get an appointment with a mental health practitioner. And as I said, even more so for the younger people. 49% of people report less energy, 42% trouble sleeping, 33% say there's an increase in alcohol use, the morale is down. And as I say, therapy is difficult to get. In-person therapy is almost impossible to find. So almost everything is telehealth and virtual at this point. And that includes not only psychiatry and psychology, but it includes our self-help groups like Alcoholics Anonymous and NAMI, and all the places where people can go for help generally is only available to them virtually. Next slide, please. As I say, the morale is declining, and 7 in 10 employees say this is the most stressful time of their career. So there's a great amount of anxiety, angst, stress, difficulty that people have been coping with. And, you know, as we get ready to open or reopen and re-entry, we call it, there's great news in that, and people are thrilled about that. But at the same time, there's a lot of anxiety about what that's about. For example, some of what we heard already. Next slide, please. So the normal coping mechanisms that people have are absent. You know, going to the gym, going to restaurants, movies, vacations, friends, those things that we normally do on a day-to-day basis to deal with our general or work-related stress has been gone for most of this year. The other thing I have here, transition roles absent. I was thinking about this, you know, there's this, because so many people are at home and their transitions and their roles are blending. You know, it used to be you'd get up in the morning, you'd give your kids breakfast, you'd get in your car, and during that ride to work, you would sort of de-stress a little bit, think about things, listen to the radio, get to work, do your 8-hour day, come home, de-stress again, walk into the house, deal with your family, have dinner, and so on. But now everything is, for many people, has been just under the same roof and with the same people all day. So the opportunity to have those transitional periods has been absent. That also causes a lot of stress. On top of that is the multiple roles that we've taken on. I mean, many of us have been home being workers, caretakers of older people, caretakers of our children, teachers. And so all those roles have blended, and again, all causing a great deal of stress. And as I said, you know, I run the Thelma McMillen Recovery Center, which is a drug and alcohol program at Taunts Memorial Hospital. Substance abuse and alcohol use is significantly up. Alcohol use, as I said, by about 1/3. Almost 15% of people have started using substances, pills, opiates, and so on. And the overdose has spiked more than 20% overdose deaths in the last year. And that's because people are alone, they're isolated, they're staying at home, and they're relying on these very inefficient and sometimes dangerous tools to cope. Next slide, please. So go on, yeah. How can managers help? How can work people help? I'll go into some of the things that we can actually hope for from people who are running the work sites. First off, we have to manage our expectations. Managers have to manage their expectations. The difference between reality and one's expectations, the space in there is what causes stress and psychological problems. And the closer that reality and expectations are kind of overlap, the more happiness and the more acceptance will come as a result of that. So one thing managers have to do is manage their expectations, not only during this last year as they've had to do, but even in reentry. Everything doesn't change, as I said, dramatically and wonderfully just because people may begin going back to the workplace. In fact, today I just had a this is what I think will happen to most places. I have a staff of about 25 in my treatment program, and we started to talk about reentry. We've been 100% virtual in drug treatment for the last year. And we started to talk about, we need to start letting people back one-on-one patients, and we need to start letting the staff get together on very limited basis. And I must tell you, some people were accepting. Nobody was really thrilled, quite honestly. And some people are very, very worried and anxious. And we ran across the entire spectrum. And by the way, everybody is vaccinated. Everybody's double vaccinated for a long time, but there's an awful lot of fear. And so having an understanding of the stress that employees are under and not thinking that it's only, returning to work is somehow going to solve all the problems. We have to understand the kind of roles people play. They've been, as I say, home, taking care of children, teaching their children, and now if they start going back to work, there's going to be all kinds of internal conflicts. So managers need to be flexible, not just in their understanding, but they need to be flexible in terms of understanding their employees, being flexible in terms of productivity and in terms of timelines, in terms of some people may need different times off, different schedules. So there needs to be a lot of, as I say, flexibility. And then finally, improving their communication. Next slide, please. Managers need to be able to, I like this one saying, which I say, you need to be able to talk so your employees will listen, and listen so your employees will talk. And what that means is, first off, not being judgmental. And so we need to hear what people are saying. We need to validate their feelings. And I give long presentations on just this one thing and just take a moment to it. But validating feelings means when somebody opens up to you, we need to understand that how they're feeling is always correct. So if somebody says, I'm worried, I'm sad, I'm angry, we can't say to them, no, you're not. So what they feel is absolutely always correct. What people tend to do is, in a good meaning, well-meaning, is telling people you shouldn't feel that way. Now they may say it nicely, or they may say it directly or indirectly. But when we tell somebody that they shouldn't be feeling that way, they begin to shut down, or they get angry at us. So what we need to do is really understand that the person is feeling what they're feeling based on what they're thinking, and that it's real for them. And we can validate their feelings without at all agreeing with what they're feeling. So it's a really important skill to have if you want to be able to communicate to your employees. I say don't offer solutions. So when people are telling you about their problems, most people want the opportunity to discuss what they're feeling, to discuss what they're going through. And by the way, a lot of what I'm talking about in terms of employees really fits for your spouse or your partners. It fits for your children. I give a very similar presentation on parenting issues around reentry back to school. But I go by the mandate, help not asked for is criticism, even when it's correct. So if you go to solve somebody's problem and tell them what they should do, and they haven't asked you for help, one, most of the time they're not going to accept it. And two, they're going to feel like their way of doing it is criticized. So again, when someone's just talking to you, if you have some solution, it's really important to say, would you like to hear what I have to say? Would you like to, I've got some thoughts about what you might do. And as soon as the person says yes, now they're open to hearing what you have to say. So again, help not asked for is criticism. When talking to employees about their issues and their problems, we need to make sure you maintain confidentiality. Similar to when what was presented a moment ago about vaccines and whether people are taking them, what people are talking to you about, their distress and their difficulties and their stress, needs to remain between you and them. Don't analyze them, they don't jump to conclusions. Try to encourage and empathize. And as a manager, you also need to model healthy behavior, which means being open, taking mental health days when needed, exercising, just making sure that, you know, if you want people to be mentally healthy in the workplace, then you have to produce that as a model. And then finally, it's not on there, but have referral sources readily available if people are talking to you and they're very serious issues. And I'm going to get into one of those kind of referral sources in a moment when I talk about employee assistance programs. Next slide, please. Okay, other ways that the workplace can help is extra perks are important. Bring meals in, give gift cards out, awards, you know, and these don't have to be large financially, you know, meaningful awards. They, you know, sometimes a certificate of something, but the main thing is expressing gratitude and expressing appreciation and doing it specifically, doing it objectively, and doing it, and oftentimes in writing, has great impact on one's well-being, has great impact on one's productivity. Research and studies show that. And so, for example, it's much more valuable to say to some, rather than say to somebody, hey, you're really a good employee, I love what you do. It's much more valuable to be able to go up to them and say, you know, yesterday I saw you talking to Joe on in the hallway, and I really liked the way you responded to him, the way you listened, and he felt really good about that interaction. I thought you did a great job. So specific, direct gratitude and appreciation and recognition means a great deal. As I said before, encourage breaks. The workplace, you know, the workplace can encourage breaks, walks, helping people with their self-care in general. So again, all important for things that the workplace can do. Next slide, please. I'm going to just talk a moment about something called employee assistance programs. Maybe many of you know about them, but employee assistance programs are generally available in a relatively moderate to large size company. Most of the large companies have employee assistance programs. And what that basically means, I have up here, it's called broad brush program. What it basically means is it's a program that provides for the well-being of your employees, and it generally provides counseling for personal problems, family problems, legal problems, financial problems, and even work-related problems. And it's a very significant return on the investment that a company puts in for putting an employee assistance program in. I'm the director of the Torrance Memorial Hospital Employee Assistance Program. I've been running it for 30 years. And I'm going to get into the hospital program in a moment just to show as an example, but as I said, big returns. The staff feels extremely taken care of. Every employee, every hospital nurse, whatever staff member they are, and their family members are entitled to up to 5 free counseling visits per year with a licensed mental health counselor. We also have a physician's assistance program, of which I run, and it's the same program except it's for physicians. So everybody on the medical staff has the opportunity to go for counseling when up to 5 visits. And if they need to continue further, they also have good mental health benefits. So as I say, for a relatively small amount of expense, it provides a great deal of not only help care, but employees begin to feel, as I said, valued in doing so. If a company is too small, by the way, to have an employee assistance program, then I think it's important for the management of that company to make sure they have very clear lists of mental health resources that they can access well for their employees. It may only mean that they have access to 2 or 3 psychiatrists or psychologists that they work closely with, but that will take care of their employees. But one way or other, we have to have those resources available for employees. Next slide. just to show you how this works, as I say, at Torrance Memorial, we have the Employee Assistance Program. And between that and a committee that is formed out of that, we are working now on a full year planning on what we're going to do for the entire staff for the year 2021. And I'm really thrilled at how comprehensive it is. But we're putting together programs that include twice monthly lectures on wellness, on self-care, on all the things about meditation, mindfulness. So we have 24 lectures coming in the next year for the entire staff, and they're all taped, and so people can watch them at their leisure if they can't attend, in person or in Zoom. We have a team of people who go out to any unit and provide critical incident debriefing, stress management, facilitating group discussion. Again, we're dealing with frontline healthcare workers, and so they've been through a very, very difficult year, as everybody knows. And then part of that is we're doing fun events. We're planning magic and comedy days, and we're planning, musical times, and so it's a very comprehensive approach to understanding that the mental health and the mental well-being of our employees, our staff is essential, and we need to prepare for what's coming down the road. I should say for a moment, by the way, when, especially again with people like in hospitals and our frontline workers, when they're dealing with the issues that they're dealing with, like they have in the past year, between adrenaline and collegiality and what they have to do, they're able to take care of the problem well. It's when everything ends and things settle down, that's when the PTSD and the emotional pain may begin to come up. So we recognize that, and again, it's a good example of a company that is planning for a full year of taking care of their employees. Next slide. So this is a really interesting slide I found. Consider this: better mental health support now could be a competitive advantage when the pandemic ends. 93% of employees say supporting mental health will keep their company in business. And only 35% of their employees say that they have increased their support during the pandemic. So there's a big gap. And again, the companies that survive well are the ones who are going to pay attention to this mental health aspect. Next slide. No, you have it. So it was mentioned before, telehealth and digital apps. Another thing work can do is understand the value and the meaning of telehealth and how it's changed the whole landscape of medicine in general, but certainly mental health. As I say, most of the people in this community are just beginning to barely get back into into real life treatment in terms of mental health, and everything has been telehealth up till now, Zoom and Doxy and all the other platforms. And it's actually been great, quite honestly. It's been very useful. The access has been so much greater than it is in real life. And we're pretty sure that telehealth is here to stay. And as I say, it's got many advantages. And what managers need to know is be knowledgeable about telehealth, be able to refer their employees to it, to understand some of the apps that are available, and like, Calm and Headspace are two meditative apps that are great. I recommend them to people all the time, but there's also apps available for mental health care as well. So again, having those available as resources is a really important thing for managers to do. And then finally, the last slide, basically says about telehealth. 2 in 3 say the pandemic has made them more likely to try virtual care. And 88% of the people who have tried it would use it again. So I guess mostly it's management needs to be understanding, patient, and prepared for what's to come in the next year. So thank you.
Thank you so much, Dr. Gelbart. That was fascinating. It's nice to know what's being provided for sure, and what needs to be provided even more importantly. So now it's time for another survey. That's going to pop up on your screen. And how concerned are you about the long-term health effects of COVID-19? Not concerned at all, somewhat concerned, very concerned, or prefer not to answer. So go ahead and select a response there if you can. And in a few seconds here, I mean, we'll give you a few minutes to fill that out, or to, I guess it's just a click, before we show the results here, and we'll see how all of you feel about this, how concerned you are about the long-term health effects of COVID-19. I'll be very curious to see the results here. Let's see. Very concerned, 62%, and somewhat concerned, 35%. So fascinating. All right, so with that, next from the Long Beach Medical Center Department of Cardiology, Dr. Chevelle will share with us about the connections between COVID-19 and the cardiovascular health in children, address concerns we've been hearing about the AstraZeneca vaccine, some implications regarding the COVID-19 long haulers, and more. And if I may now, Dr. Chevelle, the floor is yours.
Okay, thank you. And thanks for inviting me. Thanks for having me. Next slide, please. Okay, next slide. So I'm going to start with just a very quick background of cardiovascular disease. And I think most people know this, but recall that cardiovascular disease, at least in the United States, is the #1 cause of death. And when we use the term cardiovascular disease, it's a general term, but we're referring to certain conditions, including heart attack, or myocardial infarction, or abbreviated as MI, a stroke, heart failure, abbreviated as CHF, and the most fearful complication, which is cardiac arrest or sudden cardiac death. Basically, your heart stopping or going into an arrhythmia, and you need to be resuscitated. 1 in every 3 deaths in the United States is from heart disease and or stroke, and the numbers are staggering. 2,200 deaths per day, 66,000 per month, and over 800,000 per year. Next. There's a few interesting surveys that have come out as we've hit this COVID-19 pandemic. And we've been in this, as everybody knows, for approximately a year, although I would suggest that COVID was circulating probably January, February, at least in the Los Angeles area, but really the full effect has been for the last year. There's been multiple different surveys trying to assess the impact of COVID on healthcare. And we've heard from others that COVID has impacted our work lives, our personal lives, our kids, our parents, our grandparents, our ability to exercise, to eat out, to enjoy friends and family. But it's really impacted healthcare access. And so this is just, I'm going to show you 2 surveys. This is one where the question was asked, how did it affect you? 41% of respondents said no change in access, meaning they went to their appointments, but about 59% said there was a change in access. And that was from a number of different reasons. About 32% the provider canceled the appointment. You know, recall that small primary care physicians' offices couldn't social distance, couldn't get patients safely in, so they just said, I'm closing shop, like so many of these small businesses. Patients, about 16% canceled their appointments, and about 22% of patients postponed the appointment. They said, I'm not coming in, let's move it down the line. Next slide, please. This is also interesting. You know, what happened when you did this? So about half of the public said they skipped or postponed their medical care because of the outbreak. And then they followed up and said, well, what happened to your overall medical condition? Did you get worse? And about 11% of people got worse. And I know in my very, focused area of cardiovascular disease, if you've got, for example, bad heart failure, and your doctor is adjusting your medicines and they can't do that, you are clearly going to get worse. And I think we've heard about that from psychiatric issues. I'm sure there's other issues. I was talking to an oncologist here, a cancer doctor here, and he said he basically hasn't done any screening for cancer in the last year. So on the cancer front, we're going to see this dramatic resurgence of cancer and aggressive cancer a year, 2 years from now. So all these effects. Next slide, please. This is also interesting. 4 in 10 adults in this survey reported avoiding medical care because of COVID concerns. And it turned out that people with disabilities, perhaps people that needed more access to healthcare, were more likely to defer care. And people with 2 or more underlying conditions were more likely to defer healthcare. So people are deferring, but those that have underlying conditions defer more commonly. Next slide. So just for 1 second, I want to differentiate this because I'm going to show you some very interesting data. but I just want to make sure that we're all clear about the difference between a heart attack and cardiac arrest. And there's some overlap here. A heart attack basically means, for the majority of patients, basically means a blockage in a heart artery. That blockage restricts blood flow. The downstream muscle, the myocardium, dies, and you have a myocardial infarction or a heart attack. And occasionally, if that heart attack is large enough, that can lead to a cardiac arrest. You can have an arrhythmia, most commonly a ventricular arrhythmia. So heart attack is one thing, cardiac arrest is another. A heart attack can lead to a cardiac arrest. Next slide, please. So if we look at this, there's some interesting findings when we talk about heart attacks and cardiac arrest. And I'll give you some reasons for this, but I will say that we don't know why this is going on. But in the 10 weeks following the COVID-19 emergency, visits to the emergency room declined for heart attack nationwide about 23%, stroke about 20%, and for those patients with diabetes needing to come in because their blood sugar was high, about 10%. Next slide. So why is this? And I don't know, the studies are coming out, but potentially a fear of travel. Patients and loved ones are reluctant to come to the hospital. A fear of calling 911. I don't want to bring others, healthcare providers, into my home. A fear of hospitals. When this started a year ago, 9 months ago, all the COVID patients were in the hospital. So it makes sense that you would not want to go to the hospitals. I'll just pause and tell you right now, and I obviously work in a hospital, but hospitals are the safest place you can be. Everybody's vaccinated. The doctors are vaccinated. The staff is vaccinated. We're surveying patients and visitors when they come in. So there should be absolutely no fear if you need to come to the hospital. And obviously the stay-at-home order, we were told to stay at home. I'm having a little bit of chest pain, but I've got to stay at home, so I'll stay at home. Next slide, please. Here's some interesting data. I'm going to show you data from New York City, and then we'll follow it up with LA. What I'm showing you is data from 2019 and data from 2020. 2019 is in the lighter color, and 2020 is the blue color. On the far left, cardiac arrest. These are 911 calls for my husband collapsed, he's not breathing. That's cardiac arrest. The middle is cardiac arrest related deaths. And then the final slide is confirmed COVID-19 cases. And what you can see is comparing 2019 to 2020, a dramatic increase in 911 calls for cardiac arrest, again from New York City, a dramatic increase in cardiac arrest related deaths. And then finally, as we know, a dramatic increase in COVID-19 deaths. Next slide. So why was this? Why were we seeing more cardiac arrest related calls and deaths? Well, probably a delay in care. We weren't calling 911 because we were having chest pain, and that potentially, as I said, could have led to a cardiac arrest. Also, recall that COVID-19 is a respiratory illness. So it could be you were at home, short of breath, not feeling well. Perhaps you didn't even know you had COVID-19. You got sicker and sicker. You said, gosh, I've been told to stay at home. I don't want to call 911. You had ongoing respiratory symptoms. And I'll just say, I saw a lot of these patients. I could stop and tell you a lot of stories. I saw a lot of patients that were sick. The wife or the husband said, call. They said, no, I don't want to go. And they arrested. So that respiratory distress could have led to hypoxia and cardiac arrest. Next slide. Real quickly, data from LA County. As Dr. Halai mentioned, LA County, this is like a country, 10.1 million people, as you know, 3 times the size of the state of Israel. I'm sorry, the country of Israel. We have an integrated system of care. We take care of patients with acute MI through a system we call SRC, STEMI Receiving Centers. That means that if you have an acute MI or a cardiac arrest, you will go to one of 36 dedicated centers. Torrance Memorial, Cedars-Sinai, Harbor UCLA, the Mecca of Healthcare, Long Beach Memorial. You'll go to one of these 36 centers. We have dedicated transport. We have to submit this data to EMS. And I'm going to show you some of this data. And this was just accepted for publication about a week ago. And what I'm showing you in the orange is LA County 911 calls for cardiac arrest. It's a little hard to see, but a 21% increase. And you can see we went up from March. What I'm also showing you is a 7% decrease in the blue for calls for acute MI. So cardiac arrest went up 21%, acute MI went down 7%. This is data from March to May. This is our first surge. The data from our most recent surge is 5-fold higher than this. So the same thing, but 5-fold higher. Next slide. So what have we been trying to do and what should we all do? Well, public outreach, trying to get out there to our friends, neighbors, our grandparents, our cousin, our aunts, tell everybody that if you're having symptoms, you should not delay care. So just like you would if COVID wasn't around, you got to call 911. Next slide. Let me just briefly talk about 3 other issues. I want to briefly talk about this. And, you know, in medicine, we pride ourselves on evidence-based medicine, published reports that are so-called peer reviews. So, you know, I have a lot of friends that I'm still friends with, my junior high friends, and they say, well, what about this? And I said, well, what journal was it published in? And they said, oh, I looked it up on Google. You know, Google is not peer reviewed. So let me show you some of the actual data. So there was concern about this AstraZeneca vaccine and blood clots. Concern was raised in Europe. And as they were vaccinated in Europe, 30 or so blood clots were reported. They were just reported. So 12 European countries suspended the vaccine, and basically a full investigation was done by the agency there called EMA, or European Medicines Agency. And they looked at all these blood clots and they found not 30, they found 25 out of 20 million vaccinations. That was less than the general population, okay? So yes, case reports are important. Yes, something on Google is important, but show me the data, and the data suggests that this is not something that is significant. Also, as this was going on, the US trial completed, and there was absolutely no increased risks of blood clots. So I would say right now, AstraZeneca has no significant increase in blood clots. And we can see maybe at the end what Dr. Halai thinks, but I think that's the upside. Next slide. We all know about respiratory manifestations of COVID. This is a respiratory illness. It starts as a respiratory illness. You get shorter breath, you get lung injury, you get lung destruction. The lung tissue is destroyed. Next slide. But there are some short-term and long-term cardiovascular effects that I just want to tell you very quickly. So, and this is all coming out now. We've been aware of this from the beginning, but the published data is growing and growing and growing. So if you look for this, you will find this. So there's a condition called myocarditis, inflammation of the heart. We've known about myocarditis for years. Viruses can cause myocarditis. Drugs can cause myocarditis. COVID can cause myocarditis. If you check the blood on a series of COVID hospitalized patients, if they're having cardiac conditions or not, you will see that a biomarker called troponin, which is an indicator of muscle damage, is elevated in about 30%. If you look at those patients that have an elevated troponin, their chance for death is higher. That is clearly true. But by the way, if you do that when patients come in with a non-COVID respiratory illness, I could show you the same data. There's also data coming out looking at something called cardiac MRI. MRI is a technology that gives us very good pictures of the spine, the back, the neck, whatever you want, and of the heart. And if you do cardiac MRI in COVID positive patients with a respiratory illness, about 50% will have abnormal cardiac imaging. We don't know the implications of that. That doesn't mean that they're going to have heart failure down the line, but it's a very interesting observation. Next slide. So those are the short-term issues, but there's some long-term issues. And if you look at the upper left, this is a nice diagram that puts it together. And, you know, I read a lot. I went to UCLA Medical School, which by definition means I'm really smart. But we don't know a lot that's going on. So there's lung injury, there's decreased blood levels, hypoxia, there's inflammation, there's dysfunction of your capillaries, there's all these molecules that are circulating. It affects the brain, the heart, and other organs. And it clearly can affect the heart short term, but it probably can affect the heart long term. But we don't know the long-term impact. Next slide. So there are these terms that people are using now, and I've seen these patients in my private practice. I see patients 2.5 days a week. I'm seeing a lot of these patients, these so-called long hauler effects, or these delayed ongoing effects, shortness of breath, fatigue, chest pain, anxiety, stress. I have a very good friend who's extremely smart. He's in the medical device world. This guy is smarter than anybody you've ever meet. He was a collegiate athlete. He was a linebacker. I fly fish with him, so I like him. And he got COVID. He was pretty sick. He said it was like a bad flu, but he had 6 weeks where he was in a brain fog. He said, I couldn't concentrate. I could get my 2 kids breakfast, but if my wife said, what's our balance in the checking report, I would look at my check balance, and then a minute later, I couldn't remember it. He's better now, but he had 6 weeks of these brain fog. So what are we doing in the cardiovascular space and in medicine? Well, number one, there's got to be an awareness. We have to be aware that this is happening. We have to, as Dr. Gelbart said, we have to acknowledge there's an issue, support our employees, our friends, our relatives. There are now post-COVID clinics being set up. Can you imagine? Just a clinic where I'm going to see only COVID patients with a COVID infection. I'm just going to estimate, I've seen 40 patients in my cardiology practice post-COVID. Chest pain, I'm short of breath. What do you do? We're developing algorithms and protocols on what we need to do. We get blood tests, we get an echo, sometimes we get cardiac MRI, and there's now a number of surveillance registries. There's multiple ones. Just briefly, there's a 10,000, believe it or not, 10,000 hospitalized COVID patients are going to be followed for 1, 3, and 5 years. There's a 300 patient registry where they're all going to get a cardiac MRI. We're participating in an acute MI registry. This will probably be 4,000 or 5,000 patients. American Heart Association has a separate registry. So as time goes on, we're going to get more objective medical information about what we're dealing with. Next slide. Next. Let me thank you for your attention. Let me say stay safe, stay vaccinated, go fly fishing. It's an outdoor sport. Next. This was the Upper River, February 2021. Next, this is me with a nice rainbow trout, fly fishing, Crowley steelhead. I do catch and release. That fish went back and lived. These are my 4 friends that I fly fish with. So thank you very much for your attention.
Thank you, Dr. Chevelle. Excellent information, and thank you for presenting it in a way that all of us in the non-medical field can digest and understand real easily. I want to know how big that fish was, but we'll get to that afterwards.
It was extremely large.
Okay, thank you so much. Okay, we have time for just a few questions and answers. Dr. Halai, I'm going to start with you. I think this one will go to you, and if you'd prefer to have somebody else answer it, just please say so. What are the pros and cons of the different vaccines? Please explain how these vaccines work.
Well, that's a big one. I don't know if there's enough time to go into the details of how they work. But I think what we can say is all of the vaccines, they kind of prime the body to produce a protein and kind of like give the body memory of COVID. And once the real infection comes about, it's like you have your immune system can kickstart, jump into it and fight it off. And that's what all of them do. They, the mRNA vaccines work through messenger RNA. The Janssen vaccine works through, it's like a viral vaccine, so it works through DNA enveloped in, kind of trans carrier. I can send some, whoever's asked that question, some slides later about this, but all of the vaccines are safe and effective. So I don't think that, we should be getting into, hey, which vaccine should I get? Let me pick Moderna, let me pick Janssen. The main difference is the Pfizer and the Moderna are 2 doses, and the Janssen vaccine is 1 dose, which, may be beneficial in some situations and not in, so kind of from a public health perspective, we have to think about, okay, who are we not going to be able to vaccinate with 2 doses? For example, the homeless population, people who are moving around, some of our farming community, in those situations, maybe 1 vaccine just because of the 1 dose nature and also because of storage, etc., might work. But then on a consumer perspective, like on a patient perspective, I think any vaccine you get, I would have no hesitancy taking that vaccine. And all kind of to keep in mind that the full protection kicks in 2 weeks after the last dose. So if you're getting the 2-dose vaccine, it's 2 weeks after the 2nd dose. With the Janssen vaccine is 2 weeks after the 1st dose. So you're still vulnerable in that time period. but it builds over time. It's not an on and off switch. So it builds over time. You keep getting protected. All are safe, all are effective. Get the vaccine that's available to you.
Thank you very much. I like the mantra.
Halai, sorry, Kelly, can I just add one thing very quickly?
Please do.
Dr. Halai said this in her slide, but I think it's extremely important. They're all effective. And there's been a little bit of bad press for the Johnson & Johnson vaccine. But if you remember the data is in the patients that got that vaccine, nobody was hospitalized and nobody died. You may get a little bit of COVID, you may feel a little sick, and that's fine, but you're not going to be hospitalized, you're not going to die. So any vaccine that's out there, you need to get the vaccine.
Thank you, Dr. Chevelle. One kind of follow-up question to that too. Is there anything you recommend for people to do to prepare for either the first or the second dose of the vaccine? Sometimes we're hearing with the second dose, people have a little more symptomatic, for a short time. Is there any magical, other than Tylenol or a vitamin, that people should be taking to prepare?
No, there's a lot going around. Take vitamin C, take this, take that. It's just your body's immune system. You want it to work. It's a manifestation of it working. And, what I typically say is don't pre-medicate, get the vaccine. There's been very variable kind of responses. Like for me, I got arm, like a little bit discomfort and headache after the first dose and nothing after the second dose. In others, when they get the second dose, that's when they get, some symptoms. It's highly variable. There is no standard. Do not fear it. Get the vaccine. Even if you do get some arm pain, a mild fever, tiredness, something like that, it's very short-lived. And 24 to 48 hours, you're going to be back to normal. The vaccine does not give you COVID. None of the vaccines will give you COVID. You will get back on your feet in a short amount of time. So do not fear it. And if you do get symptoms, then it's okay to take Tylenol or, one of the other kind of symptom relief medicines, but just, have a hot shower, get to bed. That's probably as effective as the other kind of remedies that are going around.
Thank you, Dr. Halai. Okay, Jessica, do you have a couple questions?
Thank you. I do. And I feel like we've put a lot of attention here on Dr. Halai. So I'm going to pivot a little bit to a question I have here that maybe Lisa can answer. The question was presented here. How will the community be equipped to handle reopening all the businesses? Like, how should we prepare as citizens of the community? And I don't know legally how you answer that, but how would you give advice to a business on that matter?
So going back to the slides that I showed, and I would go to the links that are being shared in terms of setting up your CPP, following the county guidance, I think is really key as far as the protocols for your particular industry.
Excellent. Thank you very much. And then I had a question here for Dr. Gelbart, how to overcome anxiety. And this was a question that was submitted before your presentation, which I think you covered very well. The question was specific about how to overcome the anxiety once we're allowed to be out again with lots of people around and having to go back to normal. Not everybody's excited about that idea. I don't know if you had any recaps you wanted to do there to address that.
Just real briefly, because the answer is really, the discussion is long, than we have, but it's some of the things I mentioned. It's acknowledging your feelings. It's anxiety in general is the most common disorder, but it's also the most treatable. And by the way, let me say one more thing else. We all have anxiety. So anxiety doesn't mean you have a problem. Sometimes anxiety is a positive thing. Sometimes anxiety is motivating. So, and since we all experience anxiety on some level, again, when it becomes dysfunctional, when it interferes with your day-to-day activities, when you can't do things, then you need to do some of the mitigating factors. And if those don't help, then you need to go get some professional help, because then it is, as I say, very treatable. But being nervous or anxious about, going back to work, going to a restaurant, perfectly normal. And maybe that's the first step, is normalizing those feelings.
Thank you so much. I think we're about to end here. I'll pass it on to Lauren.
Wonderful. First, Kelly and Jessica, thank you so much for emceeing this really informative evening. It was a different focus for us, and I really appreciate the focus on reopening and the workplace. I want to special thanks to our panelists. Really fascinating. And we will definitely send out resources with the follow-up email to anybody who participated or registered. So we will, we're skipping the resource slides as a way of getting through some of the questions. We also have a events survey in the chat. So if you're able to respond to that, we'd love to know, get your feedback. What did you think about it? What could we do better? If you have any ideas for future topics. And with that, I think I'll just close it out. We went a little bit long, but really good information. Thank you, everybody. Stay safe. Go fishing, as Dr. Chevelle said. And we hope you have a really lovely evening. Thanks to everybody.
Thank you.
Yeah.